All right, we're gonna go over procedures for the HBOT. So if you're the first one turning it on, first off, we're gonna turn on the AC. There's a switch in the back, little black switch, turn that on. If you go to the front, power, just like that. If we're going to set a different temperature, we're gonna set it around 4.25. Don't worry about what that means. If I wanna change the setting, I'm gonna push setting, then I can move it up or down, okay? After that's done, set it again, and it goes back to the home screen. So make sure you turn that on. For the unit itself, you have your air compressor. This is which brings air to inflate the chamber. And then you have your oxygen concentrator, which brings it into the mask itself. So I'm gonna turn on in this 0 position. You can turn it on as long as you want. It's basically a neutral. So if it's on, it's on. The green light's on. Same thing here. So in general, we wanna run it at about 10 liters of oxygen. So O2's on. That's 10 liters. We're gonna put it a little bit above. So maybe when it hits 10, 1, 2, kind of keep it there. If you blow it too hard, it depends on the client as well. So for the chamber itself, whether it's you, whether you're putting on the person, around their head, they can tighten with the straps, and they can close this to make it a little bit tighter. Make sure when you're done, you sanitize it every time. To zip it up, there's 3 layers of zippers. Just make sure you hit all 3. So there's 1, the second one's important because it has the blue flap. That's what kind of seals the chamber. And then last one. To actually inflate the chamber, you want to make sure that this knob is at close. So it can be open or it can be closed. As the chamber starts to fill up, what this will probably hit is anywhere, at 1.3 ATAs, it's equivalent to a little bit over 30 kPAs here. So as it inflates, it'll hit 30 or above, and that's to hit pressure. Once it hits its max pressure, you'll hear a lot of hissing through this guy, which is bringing it back down to the pressure that you want. I'm gonna let it inflate, and I'll show you how to deflate and turn off the machine. All right, so now we're gonna decompress the chamber. Especially if the person has never been in it before, we don't want to depressurize too fast. So basically, it's closed right now. Just turn it a little bit. And then pretty much let it run down. So again, it goes to a little bit over 30. And then we do not open the chamber until it hits 0. That's really, really important. We don't want whatever to happen. But after it fully depressurizes, then I'll show you how to turn off the machine itself. HBOT! All right, now we're gonna, so the pressure is down to 0, so now we can open up the chamber. Again, there's the 3 zippers. 1, 2, and then 3. So help out the client, or if you're in there, you come out. To turn it off, basically turn off the 2 green lights. So turn off the air compressor, turn off the O2 concentrator. If you, for some reason, you're using the timer, so let's say I'm using the timer to 30 minutes. When the timer runs out, let's say it runs out, it's important to remember that you still have to turn off the O2 concentrator. Okay, so that's important. If you're the last one here, make sure you turn off the AC. You just go to the switch in the back, just flip that off, and then yeah, make sure that's off. This power will stay on, but as long as the O2 and the oxygen and the air compressor aren't going, you're fine. So there's that. Go in here, clean this mask with there's alcohol wipes to clean this mask. Make sure everything is set as far as how straight the chair is. Make sure all the connections are in place. And then from time to time, this gets crooked depending on how you come out. So always do your best to straighten it up again. So you either just kind of pull here and straighten it out, or sometimes this base moves and you might need to adjust that as well. So before everyone that comes in, whether it's yourself, and after, make sure that everything is set for the next person.